Well, good morning. I believe we're live, and welcome to the IFC, second IFC of this legislative session. And I would like to remind everyone that we've got a dense agenda. We're right in the middle of session. We have a joint full after this, and a real quick one. And so I need to move through this as quickly and as efficiently as possible, so that we can actually get our other business done today. Please notify me if you have any questions. And since this is a large committee and I have a couple chats going, I don't have Teams working right now. We can raise hands and we'll collectively do this. Feel free, if I move past something, to just raise your voice and we'll stop and I'll recognize you. Right after this IFC, we will adjourn, and we'll have to give broadcast services and staff some time to switch over to the other one. Just stay put, and we're going to go to a joint full right after that of the joint full of Senate Finance and Assembly Ways and Means. And so please, don't go too far, because we're going to need to start right up so that we can get our other business and floor done today. The next agenda item is roll call. Ms. Kaufman, will you please call the roll?
Thank you, Mr. Chairman. Assemblywoman Benitez Thompson.
Here.
Assemblyman Frierson.
Here.
Assemblywoman Gorlow.
Here.
Assemblyman Hafen.
Present.
Assemblywoman Howdigi.
Here.
Assemblyman Levitt.
Here.
Assemblywoman Miller.
Here.
Assemblywoman Monroe Moreno.
Here.
Assemblywoman Peters.
Here.
Assemblyman Roberts.
Here.
Assemblywoman Titus.
Here.
Assemblywoman Tolles.
Here.
Assemblyman Watts.
Here.
Vice Chair Carleton.
Here.
Senator Cannizzaro. Senator Dennis.
Here.
Senator Don Deriloup.
Here.
Senator Goycochea.
Here.
Senator Hammond.
Here.
Senator Kieckeffer.
Here.
Senator Ratty.
Here.
Senator Severs-Gansert.
Here.
Chair Brooks.
Here. And please mark Senator Cannizzaro present as she arrives. And with that, we'll jump right into the agenda. The first agenda item is public comment. There will be on IFC, we do a public comment period in the beginning and at the end. Because of time constraints today, we're going to limit public comment to no more than 15 minutes. And each member each member of the public who calls in, we want to limit to 2 minutes each when they give their public comment. BPS, will you please open the public comment line? And please let me know after you have it opened, and we'll see if anyone is on.
Chair, the line is open, and we have one caller queued up already. Would you like me to go ahead and start with them?
Please do.
Caller with the last 3 digits, 577. Please slowly state and spell your name. For the record, you will have 2 minutes and may begin.
Good morning. Chris Daly, D-A-L-Y, Nevada State Education Association, the voice of Nevada educators for over 120 years. This morning, NSE is particularly concerned about Agenda Item C, number 34, which adds nearly $23 million from CARES ESSER 2 to the Charter School Authority. During the 2019 session, NSE pushed for greater accountability for charter schools. While our proposal to cap charter school expansion was not successful, the legislature passed a 5-year growth management plan for charters. Interestingly enough, while the Charter School Authority was developing this growth management plan, they approved nearly 5,000 new charter slots. This past week, we found that charter school slots are projected to increase 8.6% in fiscal year 22 and a whopping 15.9% in fiscal year 23, while enrollment in neighborhood public schools remains relatively stagnant. While the Charter School Authority has done some improvements since last session, including actually conducting site visits, let's be honest with each other. The Charter School Authority is only now clearing a relatively low bar of accountability. While it's great that the Charter School Authority has begun to address the baked-in biases against disadvantaged students, when looking at overall charter student populations, charter schools still serve the proportionately fewer at-risk students, English learners, and students with disabilities. Even with progress on more diversity and new charter seats, there is no path for charters to achieve parity in the foreseeable future. But what's most concerning is the behavior of many charter schools during the pandemic, who claim to be public schools when it's convenient and something else when it's not. According to a December 24th article in the Nevada Current, Nevada charter schools took $31 million in forgivable loans from the Paycheck Protection Program in 2020. This included a $4.6 million loan to Doral Academy and a $4.6 million loan to Pinecrest. These federal funds were not available to neighborhood public schools who got hit with major cuts during last summer's special session. During the darkest days of the pandemic, charter schools gained the system by triple dipping, taking state funds, per pupil funds, and CARES Act funds, and PPP
Excuse
funds,
me, I'm sorry.
all while playing by their own set of rules.
Excuse
In
me.
order to
as
push
we
back against
discussed
charter
earlier,
is a drain on our system of
2
neighborhood
minutes
public
is
schools.
up, and so we need
would
to
ask
move
this
on to our
committee-
next caller, please.
To make public comment, to get in the queue for public comment, please press star 9 now to take your place in the queue. Caller with the last 3 digits, 044, please slowly state and spell your name for the record. You will have 2 minutes and may begin.
Good morning, esteemed body. My name is Dr. Tiffany Tyler Garner, TIFFANY-TYLER-GARNER, and I'm calling on behalf of the Children's Advocacy Alliance to thank you for your leadership during this critical time and any consideration you are given to Agenda Item C, List C, and in particular the following items. Items 16 and 17 to support school readiness in pre-K. Item 18 to help address trauma, particularly for the uninsured, underinsured, or undocumented. Item 21 in support of educational needs for homeless youth and children. Item 24, educational supports for adjudicated youth. Item 49, assistance for low-income families. 64 and 65, particularly supports dedicated to WIC, including breastfeeding moms. Items 72, 73, and 79, which are an investment in home visiting and nurse-family partnership, evidence-based programs that provide critical prevention and supports for families before they arrive at the doors of our child welfare system is one support. And then additionally, item number 83, Coronavirus Response and Relief Supplemental Act funding that will shore up our child care capacity by providing critical relief to our child care providers during this time, particularly as we pivot toward recovery. I thank you for your time this morning, your leadership, and implore you to consider these critical investments for our children and families in Nevada at this unprecedented time. Thank you.
Chair, the public comment line is open and working. However, we have no more callers at this time.
Thank you. We will now move to our next agenda item, and that is Agenda Item C, the work program revisions and position changes. And Mr. Thorley, will you please walk this committee through the list of work program revisions and position changes that staff has identified for additional discussion?
Thank you, Mr. Chair. Good morning, everyone. Wayne Thorley, LCB Fiscal Analysis Division. I'll be going through List C and indicating which items fiscal staff has identified for discussion. There are also 2 items that have been withdrawn. I'll note those. Starting on the first page of List C, item C5, the Judicial Discipline Commission has been withdrawn. Then on page 3 of list C, agenda item 15, Department of Education Data Systems Management has been recommended by staff for discussion. Also on page 3, agenda item C17, Department of Education Office of Early Learning and Development has been recommended by staff for discussion. Moving on to page 11 of list C, agenda item C61, Department of Health and Human Services, Healthcare Financing and Policy, Healthcare Financing and Policy Administration. That item has been withdrawn. Next on page 13 of list C, item 73, Department of Health and Human Services, Public and Behavioral Health, Maternal Child and Adolescent Health Services has been recommended by staff for additional discussion. This agenda item also relates to item C79, which is on page 14 of the list. C79 has also been recommended by staff for additional discussion. This is the Department of Health and Human Services, Welfare and Supportive Services, Temporary Assistance for Needy Families. Moving on to page 16 of list C, agenda item C94, Department of Employment, Training and Rehabilitation, Unemployment Insurance has been recommended by staff for discussion. And then lastly, going to the last page of list C, page 24, the Department of Administration Director's Office reclassification has been recommended by staff for additional discussion. I will also note that on the informational items list, which is list G, staff has not recommended any items from the informational item list be pulled for additional discussion.
Thank you, Mr. Thorley. Do the committee members have any additional items they would like pulled for discussion, either from the work program list, list C, or the informational item list, and that's list G?
Chair.
First up, I think I have Assemblywoman Titus.
Thank you, Mr. Chair. I would like to see pulled, if I might please, number 50, 56, 58, 60, 66, and 83.
Thank you, Assemblywoman Titus. I believe I also have Assemblyman Roberts.
Yes, Mr. Chair. I previously wanted 101. I can pass on that. I'd like to pull 135. Just one.
Was that 105?
135.
Thank you.
And Senator Kekeffer.
Thank you, Mr. Chairman. Item 20, please.
Senator Sievers answer.
Thank you, Chair Brooks. Item 18 and Dr. Titus already had us pull 83, so those were my two. So just adding C18. Thank you.
Mr. Thorley, if it's possible, if you could give us that list of all of the items that we'll be pulling, including the ones we've identified with staff, as well as the ones the members just requested.
Certainly, Mr. Chair. So I have items C15, C17, C18, C20, C50, C56, C58, C60, C66, C73, C79, C83, C94, C135, 135, and the Department of Administration Director's Office position reclassification.
Mr. Chairman,
Yes, Mr. Kiefer?
I had thought that Assemblywoman Titus had requested C62. If that was not on her list, I would like to talk about 62 as well. It's only $300 million.
So C62 as well. Okay, well, this IFC meeting just got long. So keep in mind that we do need to move through this agenda as quickly and as efficiently as possible. And so if you can keep your questions and or comments as efficient and succinct as possible, it would be appreciated by the committee. So with those items pulled, I would like to seek a motion to approve all items in List C that have not been identified to be pulled for additional discussion.
So moved, Mr. Chair. Vice
Okay.
Chair Carlton.
Second, Senator Dennis.
So I have a motion from Chair Carlton and a second from Senator Dennis. Do we have any discussion on that motion? All right, with no discussion on that motion, Ms. Kaufman, you please take a roll call vote.
Assemblywoman Benitez Thompson.
Yes.
Assemblyman Frierson.
Yes.
Assemblywoman Gorlow.
Yes.
Assemblyman Hafen.
Yes.
Assemblywoman Howdy.
Yes.
Assemblyman Levitt.
Yes.
Assemblywoman Miller.
Yes.
Assemblywoman Monroe Moreno.
Yes.
Assemblywoman Peters.
Yes.
Assemblyman Roberts.
Yes.
Assemblywoman Titus.
Yes.
Assemblywoman Tolles.
Yes.
Assemblyman Watts.
Yes.
Vice Chair Carlton.
Yes.
Senator Canizaro.
Yes.
Senator Dennis.
Yeah, sorry. Yes.
Senator Don Deralup.
Yes.
Senator Goycochea.
Yes.
Senator Hammond.
Yes.
Senator Kiefer.
Yes.
Senator Ratty.
Yes.
Senator Seaver-Scancer.
Yes.
Chair Brooks.
Yes. If we get to a situation where we run out of time, we can recess and come back. And so if this gets to be too long and we have to keep the business of the day running, it'll turn into a long night in IFC. So I just want to let you know that we have some options. So I'll start with, if we could, we'll start working through the list. And we'll start with items C15, and then we'll go to C17. And so let's go with C15.
Good morning. For the record, Heidi Hartz. I serve as the Deputy Superintendent for Business and Support Services at the Nevada Department of Education. Agenda item number 15 is a work program that seeks to utilize revenue from the Governor's Emergency Education Relief Fund, or GEAR, to expand services available through Infinite Campus. The funding requested would allow us to expand the services available through Infinite Campus to serve both the Department of Education, our school districts, and our charter schools by adding 4 premium product suites to our services. That would include campus workflow, campus analytics, campus learning, and online registration opportunities through their Prime account. With that, we'd be happy to answer any questions that you have specific to this work program.
Probably, yeah.
Thank you, Ms. Hartz. I do believe that we have a question. I believe Senator Dondero Luke does.
Thank you very much, Chair Brooks. I do have a couple of questions that I'd just like some clarification on. And would you just give us some information on how the use of Infinite Campus that data would improve the identification of at-risk pupils?
Mr. Chair, Senator Dondero, this is Dr. Jonathan Moore, Deputy Superintendent of Student Achievement, for the record. In response to the question, so campus analytics includes a variety of indicators that are used to determine a student's readiness as they progress toward graduation. And so together, all of those factors, as data is inputted into Infinite Campus, the variables then are entered into the model, which then creates a score that helps determine a student's trajectory toward graduation. What that score does is it allows school districts and schools to be able to determine what necessary supports and interventions are needed to ensure that that student is moving on pace toward graduation.
Okay, thank you. So following up on that, so would the Infinite Campus process of identifying at-risk pupils reflect a single point in the school year, or that continual review of pupils' data?
Thank you for the question, Dr. Moore. For the record, it is a continuous review process. So schools are able to, anytime that they would like to make determinations about a student, or if they'd like to meet with the student or gather data set, they're able to do that continuously.
I appreciate that, Dr. Moore. Thank you. Thank you, Chair.
Thank you, Senator Dondero Luke. And any other questions on item C15?
Mr. Chairman.
I had a question.
Yes, I believe Senator Kiefer. Go ahead.
Thank you, Mr. Chairman. Thank you, Dr. Moore. So our staff indicates that the exact actual calculations for how we're going to be determining at-risk students, though, is proprietary. Is that accurate? Like, we're not going to be able to see how we're actually calculating how many at-risk students we're funding through the new formula?
Dr. Moore, for the record, so while the methodology is proprietary, there are indicators that we know that take into account the ability to generate this grad score, things such as a student's behavior. So as incidents of behavior are entered into the system, that plays a part in the algorithm. Their household demographics, if a student identifies as homeless, for example, or experiencing homeless, student engagement, so the degree to which a student is regularly attending school, as well as grades and any other academic data that's entered into the system. And so together, all of those components, which are the known components and actually the ones that schools and school districts have control to enter, work within the proprietary algorithm to help generate the score.
But any one single, any individual component that you just mentioned isn't necessarily going to put a student at the at-risk category, right?
Dr. Moore, for the record, that is correct. So they all work in concert in order to identify a student's score based on their determination for readiness toward graduation.
So I guess, and I'm not going to go on and on, Mr. Chairman. So is there data that indicates that this algorithm successfully has predicted kids at risk or risk levels in other states? And is there any way to peel back the curtain to look at what how that math is actually done?
This is Dr. Moore for the record. So in our conversation with Infinite Campus, yes, there is evidence that the algorithm measures, in fact, what it's designed to. It is in use in other states. I believe Kentucky is another example of a state that uses this campus analytics statewide. In terms of the specific algorithm, it is proprietary, and so we are privy to the indicators that comprise the algorithm, but the exact formula behind the curtain, if you will, is proprietary. But yes, there is evidence that it does work. It is used statewide in Kentucky also.
That I appreciate your answers.
I believe I had a question from Receivers Ganser. Is that correct?
Mr. Chair, so I have a question on 18, not on this one, but I do appreciate the questions that have been asked and the responses. Thank you.
Okay, great.
Mr. Chair, I believe it was me, but I don't
okay.
Thank you so much.
Assemblywoman Benitez Thompson, please go ahead.
Thank you so much. So I guess I was wondering if you could tell us a little bit more about the record attendance. This has been an issue this year. I know just in reviewing my children's attendance, they look like ones who have that threshold of chronic of attendance, but there were, I think, 3 different ways of calculating attendance that were used by school districts or the department at different times during the year. And so would this goal to be to get us to kind of one consistent method to electronically count attendance?
This is Dr. Moore for the record. Thank you for the question, Assemblywoman. So part of what we're requesting with regard to the 4 premium products, one includes a campus workflow suite. And what that is designed to do is that's designed to help improve the accuracy of tracking student attendance, as well as improve efficiencies within local schools and districts around how they process attendance. So it is the hope that that particular feature will assist and aid in the effort to better account attendance. Another part of the suite that gets at the heart of attendance is the online registration component. And what that does is that helps to then improve the workflow so that school districts are effectively able to track students as they're moving through their local systems.
And so when you say moving through their local system, that would be if they changed from one school to another, or if they changed from one program to another, or when you say system, should I think of that differently?
Dr. Moore, for the record, that is correct, Assemblywoman. As they move through the local school district or shift schools, yes, that's correct.
I appreciate that. And then the last thing on just echoing what Senator Kekeffer said about the campus analytics, because we work so hard in the state to try to, when we talk about policy and we talk about what successful learning is, try to set metrics in policy to that. So like, what does it mean to be chronically absent? And what is that number of, kids who are missing days before you kind of fall into that category of being declared at risk and different things like that. So I guess as much as the vendor is willing to share with us about what they look at would be helpful to us as policymakers, because I would hate to see our analytics in a way be blinded from, or have our policy be blinded from the analytics when they could move congruently.
This is Dr. Moore for the record. Thank you for the question, Assemblywoman. Yes, we are able to export certain data elements from the analytics. And so as we have those available and as they're requested, we would be happy to share that.
Thank you, Assemblywoman Benitez Thompson, for the question, and thank you for the response. Any other members have any other further questions on item C15? I see none. So I'm looking for a motion to approve item C15.
So moved.
I,
second here.
who was that motion from? I apologize, I didn't see.
Dondero Loop.
I have a motion from Senator Dondero Loop and a second from Vice Chair Carlton. Any discussion on that motion? Senator Kiefer.
Thank you, Mr. Chairman. Yeah, I can't support this. I think the idea of turning over our formula to an algorithm that we're not allowed to understand is not appropriate. I think this move to a weighted funding formula or to the pupil-centered funding formula to target additional interventions for at-risk pupils is critical as we move forward. And being unable to understand how people get identified as at risk, knowing that it's some combination of many factors that some pupils may fit into, some may not, just doesn't allow us to do our job. And for that reason.
All right. Any other discussion on the motion?
Mr. Chairman, if I may.
Yes, please, Vice Chair Carlton.
And thank you, Mr. Chairman. And I can kind of understand where Senator Kickover is coming from, but infinite campuses has been around for a while. We're moving forward. It was my understanding there are some things we will be able to get, and I think the majority leader put it very well, that we want to make sure that our policy and our data analytics go together, and I have not seen anything yet that would give me concern on that. And I was somebody who had to be sold on this new formula, so it's not like I'm all the way in the boat on it yet. So but in this particular case, I believe we've addressed the concerns, so I have no problem with it moving forward, but I do understand where some of the concerns are. But I know that there are some things that through this process, and it's not new, this is just the way that the system is set up. So I'm fine with this moving forward. Thank you.
Thank you, Vice Chair Carlton. I feel the same way, and I appreciate that you encapsulating that argument. Do I have any other discussion on the motion for item C15? Okay, seeing none, can Ms. Coffin take a vote?
Assemblywoman Benitez Thompson.
Yeah.
Assemblyman Frierson. Assemblywoman Gorlow.
Yes.
Assemblywoman Gorlow.
Yes.
Assemblywoman Haven.
No.
Assemblywoman Howdy.
Yes.
Assemblywoman Levitt.
No.
Assemblywoman Miller.
Yes.
Assemblywoman Monroe Moreno.
Yeah.
Assemblywoman Peters.
Yes.
Assemblyman Roberts.
No.
Assemblywoman Titus.
No.
Assemblywoman Tolles.
No.
Assemblyman Watts.
Yes.
Vice Chair Carlton.
Yes.
Senator Canizaro.
Yes.
Senator Dennis.
Yes.
Senator Dondero Loop. Senator Goycochea.
No.
Senator Hammond.
Oh.
Senator Kiefer.
No.
Senator Ratty.
Yes.
Senator Severs Ganser.
No.
Chair Brooks.
Yes, and I did not hear Senator Dondero Loop's reply.
I'm sorry, yes.
Motion passes.
Thank you, Ms. Kaufman. That takes us to our next agenda item, C17.
Heidi Hartz for the record. Agenda item 17 requests GEAR funding in the amount of $1.8 million to be used to provide funding for pre-K seats during the upcoming fiscal year 2022, using an amount equivalent to what would have previously been funded through braided funding for Zoom and Victory. The department is requesting permission to obligate these funds for fiscal year 2022 because there is a requirement from the federal government that all funds awarded to states through the GEAR fund be awarded within 1 year of the state having received that allocation. And we are coming up on that date very quickly. That will be within the first week of May. Again, the methodology that was used to identify the funding amount was based on the amount of Victory and Zoom funding that were previously braided to support pre-K seats as we move forward with the implementation of the pupil-centered funding plan, funding that was previously designated for at-risk students and English language learners will be allocated through the pupil-centered funding plan and targets grades K through 12, not pre-K. With that, we would be happy to answer any questions.
Thank you, Ms. Hartz. Any of the committee members have any questions for Ms. Hartz on C17? I think I see Assemblywoman Miller.
Yes, thank you, Chair. My question is, and this has been, people are concerned about these programs. Would the funding be provided only to those schools that utilize Zoom and Victory funding for pre-K programs, specifically in FY 2021?
Heidi Hartz for the record. Our staff in the Office of Early Learning and Development worked with each of the subrecipients who currently provide state-funded pre-K services across the state to identify how much funding from Zoom and Victory had been used to support pre-K services. That generated that dollar value, which is the amount that we're looking to continue to support in fiscal year 2022 using these federal funds.
Okay, thank you. Thank you, Chair.
Thank you. And so just wanted to, are there any further questions from the committee on item C17?
Chair Brooks.
There we go. Senator Sievers-Gansert.
Thank you. So this is a restoration. Would this be a restoration of funds that were cut before?
Heidi Hartz for the record. These are the funds that were previously invested to support pre-K seats. As we move forward with the implementation of the pupil-centered funding plan, this type of braided funding would not be available to support pre-K seats because the funding that was previously used for Zoom and Victory would be allocated through the pupil-centered funding plan, which targets students in grades K through 12. So it is ensuring that we have funding to maintain what is currently in place in the state for pre-K services, understanding that the ability to use what are currently considered Zoom and Victory funds will change as we move into the next biennium with the implementation of the pupil-centered funding plan.
Thank you. So it's a continuation and we had to fund it differently. That's my understanding. Thank you.
Any further questions on C17?
Mr. Chairman. Assemblywoman Carlton.
Is that Vice Chair Carlton?
Yes, it is.
Thank you.
Thank you. So we're trying to true up what we're doing now, if I understood correctly, with what we're moving forward to, but it has not been approved yet in this session. So this is a bit of a transition period. I want to make sure that as we do this, that this will all transition over to what the legislature will be deciding on this in the future. This funding will all be based on what our final decisions are when we close these budgets. Is that correct? I think I phrased it correctly.
Heidi Hartz for the record. It appears that the pre-K budget account is scheduled to be closed on April 27th. And so the department believes if this work program were approved, that we could do some sub-grant agreements very quickly to obligate these funds as required by the federal funding requirements within the 1-year window that we have before any unextended or unobligated funds would have to revert to the federal government.
Good, and that's glad. And the funding methodology will be what's decided in the decision unit. So you will be using that funding methodology moving through the next biennium.
Heidi Hartz for the record. Yes, the department would honor the funding methodology approved by the legislature.
Okay, good. I just because we're doing part of it now and part of it later, I just don't want to see a change that we treat it all the same and treat all the seats the same. Thank you very much, Mr. Chairman.
Thank you, Vice Chair Carlton. Assemblywoman Benitez Thompson, do you still have a question?
No, thank you so much. That was exactly my question. I wanted to make sure that by making this decision here today, we weren't tying our hands of how we closed out that budget in a couple of weeks.
Thank you. And so do any of the other committee members have a question on item C17? Seeing no more questions on C17, I would be looking for a motion to approve the item, but and this is based upon what Vice Chair Carlton just asked and the timing associated with when the funds have to be obligated, as well as when we're going to come up with the methodology to use those funds. So I would look for a motion to approve and direct the department to allocate this funding based on the final distribution methodology approved by the 2021 legislature for the state pre-K program.
So moved, Mr. Chairman.
I have a motion from Vice Chair Carlton and a second from Senator Dennis. Discussion on the motion, Senator Kiefer.
I was going to second, but I'll just say if there's I certainly support it, and if there are extra funds in this category, I would that are available for expenditure for pre-K, I'd love for the district to bring back. Okay.
Thank you for the comment. Any other discussion on the motion for item C17? Seeing none, I have a motion and a second. Ms. Coppin, will you please take roll call vote?
Assemblywoman Benitez Thompson.
Yes.
Assemblyman Frierson.
Yes.
Assemblywoman Borlo.
Yes.
Assemblyman Hazen.
Yes.
Assemblywoman Howdiggy.
Yes.
Assemblyman Levitt.
Yes.
Assemblywoman Miller.
Yes.
Assemblywoman Monroe Moreno.
Yes.
Assemblywoman Peters.
Yes.
Assemblyman Roberts.
Yes.
Assemblywoman Titus.
Yes.
Assemblywoman Tolles.
Yes.
Assemblyman Watts.
Yes.
Vice Chair Carlton.
Yes.
Senator Canizaro.
Yes.
Senator Dennis.
Yes.
Senator Don Deralu.
Yes.
Senator Goycochea.
Yes.
Senator Hammond.
Yes.
Senator Kiefer.
Yes.
Senator Ratty.
Yes.
Senator Severs-Gansert.
Yes.
Chair Brooks.
Yes.
Motion passes.
Thank you, Ms. Kaufman. And that brings us to the next item, and that was item 18. And that's the Department of Education still. And so if we could go through item 18.
Heidi Hartz for the record. Agenda item 18 requests authority to accept an additional $844,820 in federal trauma recovery grant funds, which would allow the department to continue to fulfill the requirements of that federal grant, which include providing trauma services for families and students who are underinsured, undocumented, or who have no insurance. I would note that this work program is what we would refer to as an annual true-up, where we are balancing forward unexpended funds from the previous fiscal year into this fiscal year so that we can expend the funds in accordance with the budgets of the federal grant application. With that, we'd be happy to answer any questions that you have.
Thank you, Ms. Hartz. Do we have any questions from the committee on and Senator Severs-Ganser?
Thank you, Chair Brooks. I just wanted to check in on this program and understand a little bit more the demand and if this is enough funding or if we should be looking at potentially adding. I understand this is a grant, but I want to know about the demand side and if we're serving or if we're everyone we can or if we have a wait list for services. Thank you.
Christy McGill for the record. And as of now, the resources are keeping up with the demand. We are getting more providers in to provide services on a monthly basis. Our goal is to also not only have more providers, but also to diversify the services as well. So as of right now, the demand, the resources is keeping up with the demand.
Thank you. I appreciate the information.
And I was muted. Are there any other questions on item C18? I see none. So I look for a motion to approve item C18.
Motion to approve, Mr. Chairman.
I have a motion from Vice Chair Carlton.
Second.
Second from Senator Dennis. Any discussions on the motion? See none. Ms. Kaufman, will you please take roll call vote?
Assemblywoman Benitez Thompson, excuse me.
Yes.
Assemblyman Frierson.
Yes.
Assemblywoman Gorlo.
Yes.
Assemblyman Hafen.
Yes.
Assemblywoman Howdy.
Yes.
Assemblyman Levitt.
Yes.
Assemblywoman Miller.
Yes.
Assemblywoman Monroe Moreno.
Yes.
Assemblywoman Peters.
Yes.
Assemblyman Roberts.
Yes.
Assemblywoman Titus.
Yes.
Assemblywoman Tolles.
Yes.
Assemblyman Watts.
Yes.
Vice Chair Carlton. Senator Canizaro.
Yes.
Senator Dennis.
Yes.
Senator Dondarelu.
Yes.
Senator Goycochea.
Yes.
Senator Hammond.
Yes.
Senator Kieckeffer.
Yes.
Senator Ratty.
Yes.
Senator Severs-Ganser.
Yes.
Chair Brooks.
Yes.
Motion passes.
All right, thank you, Ms. Kaufman. That will bring us to our next item, still in Department of Education, item 20.
Heidi Hartz for the record. This work program is also a true-up of a federal grant. So this would seek to add approximately $24.3 million in federal 21st century learners federal funding, which would allow the department to continue providing academic enrichment opportunities during non-school hours. Again, this is an annual process that we use for all federal grants within the Department of Education, balancing forward any unexpended funds from the previous year. With that, we'd be happy to answer any questions regarding this work program.
Thank you, Ms. Kaufman. That will bring us to our next item, still in Department of Education, item 21. Heidi Hartz for the record. This work program is also a true-up of a federal grant. So this would seek to add approximately $24.3 million in federal 21st century learners federal funding, which would allow the department to continue providing academic enrichment opportunities during non-school hours. Again, this is an annual process that we use for all federal grants within the Department of Education, balancing forward any unexpended funds from the previous year. With that, we'd be happy to answer any questions regarding this work program. Thank you, Ms. Hartz. And I believe Senator Severs-Gansert, this is one that you had a question on as well.
I think this was me, Mr. Chairman. Appreciate it.
Senator Kieckhofer, I'm sorry.
That's all right. And I think Ms. Hart's answered my question. This is an increase. I think original authority was 6 million, and this pulls in another 24. So I guess and I think you'd indicated that unexpended funds could be balanced forward. So we expect a big chunk of this to be balanced into fiscal year 22 that could be used to support things like summer school in the coming intersession.
Heidi Hartz, for the record, yes, when we have federal grants available to us, we always balance forward any unexpended funds into the next fiscal year. That's not an uncommon business practice because many federal grants are funded on a federal fiscal year. And so that we still have several months remaining in our expenditure period.
Do you have any idea as to how much of the total of $30 million authority in this category would be balancing forward? Is there a way to project that at this point, or is it?
Heidi Hartz, for the record, I cannot project that at this point in time. We reimburse our subrecipients as they request reimbursement. And so each subrecipient, each school district submits reimbursements at a different point in time. And so it's difficult for us to project what we will expend in a fiscal year.
Thank you, Ms. Hartz. Thank you, Mr. Chairman.
Thank you, Senator Kieckhofer, and thank you for the answer, Ms. Hartz. Any other, Assemblywoman Tolles.
Thank you so much, Chair. And I was just curious, would we have received this with or without the pandemic? Or is this additional that could help with some of the learning loss that we've experienced over this past year?
Mr. Chair, this is Dr. Moore for the record to the Assemblywoman's question. So each year, the state of Nevada receives an approximate $9 million allocation. And we have been a 21st century state for the better part of approximately 6 years. And so while the funds can support learning loss, they are complement to the other funds that Nevada is receiving in response to the pandemic.
Thank you for that explanation. Thank you, Chair, for the question.
Thank you, Assemblywoman Tolles, and thank you, Dr. Moore, for the response. Any other questions on item C20? I see no other questions on item C20, so we're looking for a motion to approve C20.
Move for approval for item C20, Mr. Chairman.
Vice Chair Carlton.
Okay.
And a second from Senator Dennis. Any discussion on the motion? I see no discussion on the motion. So Ms. Kaufman, will you take a roll call vote?
Assemblywoman Benitez Thompson.
Yes.
Assemblywoman Frierson.
Yes.
Assemblywoman Gorlow.
Yes.
Assemblyman Haven.
Yes.
Assemblywoman Howdigy.
Yes.
Assemblyman Levitt.
Yes.
Assemblywoman Miller.
Yes.
Assemblywoman Monroe Moreno.
Yes.
Assemblywoman Peters.
Yes.
Assemblyman Roberts.
Yes.
Assemblywoman Titus.
Yes.
Assemblywoman Tolles.
Yes.
Assemblyman Watts.
Yes.
Vice Chair Carlton.
Yes.
Senator Canizaro.
Yes.
Senator Dennis.
Yes.
Senator Dondarelu.
Yes.
Senator Goycochea.
Yes.
Senator Hammond.
Yes.
Senator Kieckhofer.
Yes.
Senator Ratty.
Yes.
Senator Severs-Gansert.
Yes.
Chair Brooks.
Yes.
Motion passes.
Thank you, Ms. Kaufman. That brings us to, and thank you, the team from the Department of Education for answering our questions today. And that takes us to the next item. C50 from the Department of Health and Human Services, the Aging and Disability Services Home and Community-Based Services So if the Department of Health and Human Services could walk us through that.
Good morning. This is Jessica Adams, Deputy Administrator for Aging and Disability Services Division. I'm over the community-based care and developmental services programs, which includes all three of the home and community-based waiver programs. So items 50, 56, 58, and 60 are all asking for additions of federal dollars into these budgets due to the 6.2% federal medical assistance percentage, or FMAP, increase due to the Family First Coronavirus Response Act. This 6.2% FMAP increase continues through the end of the quarter, during which the declared public health emergency ends. So currently that public health emergency is declared through April 20th, meaning that currently this FMAP increase will expire June 30th of 2021. With that, any questions?
Mr. Chair, since I was the one who asked to have these pulled, if I might have the question?
Yeah, Assemblywoman Titus, and if you want to, while we have the agency, if you want to do 50, 56, and 58, and kind of, they're all kind of linked together. And so if you want to view those as one question or one.
Thank you. And that's exactly where I was going with this for 50, 56, 58, and 60. And thank you for being here today. This is all under your department, the Department of Human Services, Aging and Disability Services. And the reason I asked for these to be pulled was because the statement we recognized during the special session that there was a projection that the FMAP, that 6% increase, was going to be indeed extended, but we couldn't be sure. And so now we are witnessing that indeed it was extended. Your argument with these, all of these actually, is it says that the work program reverts the additional general fund that will be saved by the increased Medicaid revenues. So I wanted to go on record saying with each one of these then, and I've done the math of what you have there, it's about an additional $2 million that then will revert back into the general fund, because now we have had this FMAP extended and it's been documented that we do have those monies, correct?
Jessica Adams, for the record, yes, that is my understanding.
Okay, very good. So those funds just go straight back into the general fund because now we have this guaranteed FMAP funding.
Jessica Adams, correct.
Thank you very much, Mr. Chair. That is the only question I had.
Thank you, Assemblywoman Titus. Do any of the other committee members have a question on item?
Mr. Chair?
Yes.
I do. Oh, sorry, Assemblywoman Benitez Thompson.
Thank you, Assemblywoman.
Thank you. I think that's an interesting question. And I think as well as interesting is how we have to think about how the cuts in the summer that we implemented, how the extension of FMAP and then subsequent extensions kind of actually end up playing out. So the reductions that we put in place for the summer are actually not reductions that have hit yet to the providers.
So Jessica Adams, for the record.
That was specific to this group.
Jessica Adams, so for these particular budgets, item number 50, which is the home and community-based services programs, that is for our waivers for people with physical disabilities or the frail elderly. There are providers in that category that did have the 6% rate reduction. However, that is in the Division of Healthcare Finance and Policy budget. For 56, 58, and 60, those are all developmental services, and providers in those budgets did not receive any sort of rate reduction.
Assemblywoman, did that answer your question appropriately?
Yeah, I think it felt to me like we might have been confusing two different conversations. And so I just kind of wanted to make sure it didn't sound like these were that set of providers. But if
I might, Mr. Chair, I think the next one will be 62, and that one would involve the providers that we were concerned about. Thank you, Mr. Chair.
Thank you for that clarification. I appreciate that. Do any of the members have any questions on item 50, 56, 58, or 60? And we're taking those together as a group because they're all interconnected.
Mr. Chair,
yes.
if you're ready, I would move to approve 50, 56, 58, and 60.
I would accept that motion. A second?
Second.
I think Senator Dennis second. And is there any discussion on that motion?
Yes, Mr. Chairman. Mr. Vice Chair.
Yes. Vice Chair Carlton.
Thank you. And, you know, it was brought up that some of these decisions were made under AB 3 of the special session, and we all had to make decisions based on hard facts and what we were looking at moving forward. I know there was a lot of concern during the special session on making these cuts because everyone felt very strongly about that money coming in, but you don't spend money that you don't have in your hand. So that's why these cuts were made, in order to balance the budget and deal with the issues that were in front of us. So it's real easy to Monday morning quarterback on some of these things, but until you actually know what you've got in your hand, you can't make commitments for it. And I appreciate the conversation on, and we'll have more conversations on the waiver process. A lot of providers never did actually take these cuts because of the waiver process and how long it takes. So there's going to be a lot of truing up in the future. So in some instances, those providers did not actually take the cuts, and in some they did. So it'll be very good for this committee to understand exactly who took a cut and who didn't. So thank you very much for the comment.
I appreciate you reminding us all of what incredible situation we faced in the special session and some of the decisions that we made to keep the state running. And so I appreciate you clarifying that. Are there any other comments or questions, just our discussion on the motion? Seeing none, I have a first and a second. And Ms. Coffin, will you take a roll call vote?
Assemblywoman Benitez Thompson.
Yes.
Assemblyman Frierson.
Yes.
Assemblywoman Gorlow.
Yes.
Assemblyman Hafen.
Yes.
Assemblywoman Howdigy.
Yes.
Assemblyman Levitt.
Yes.
Assemblywoman Miller.
Yes.
Assemblywoman Monroe Moreno.
Yes.
Assemblywoman Peters.
Yes.
Assemblyman Roberts.
Yes.
Assemblywoman Titus.
Yes.
Assemblywoman Tolles.
Yes.
Assemblyman Watts.
Yes.
Vice Chair Carlton.
Oh, yes.
Senator Canizaro.
Yes.
Senator Dennis.
Yes.
Senator Don Deralup.
Yes.
Senator Goycochea.
Yes.
Senator Hammond.
Yes.
Senator Kieckeffer.
Yes.
Senator Ratty.
Yes.
Senator Seaver-Scansert.
Yes.
Chair Brooks.
Yes.
Motion passes.
Thank you. That brings us to our next item, which I believe is item 62. And from Department of Health and Human Services, Healthcare Financing and Policy, Medicaid.
Good morning. This is Phil Burrell, Deputy Administrator for the Division for Healthcare Financing and Policy. With me is Melissa Lawfer-Lewis, our Administrative Services Officer for Fiscal Services. For item C62, this work program requests a transfer from the parents and children category to the newly eligible category to fund an increase due to higher caseload for the newly eligible populations that been legislatively approved. This work program also requests the addition of Title 19 and Title 21 federal funds as necessary to align with additional federal medical assistance percentage, or FMAP, due to the COVID increases associated with the public health emergency, or the PHE. With the current PHE, the Centers for Medicare and Medicaid Services have offered states an additional 6.2% FMAP for the traditional Medicaid population. The additional FMAP does require states to maintain eligibility for all populations to the end of the pandemic. As a result, the division is requesting this work program to align various category and federal revenue shortfalls. With that, we're happy to answer any questions.
Thank you, Ms. Burrell. And I believe it was Senator Kiefer had a question on this.
Yeah, thank you, Mr. Chairman. I appreciate it. I think I understand exactly what's going on, and I understand the work program was prepared and submitted back in February, so things may have changed a little bit in terms of the numbers. But so ultimately, it looks like we're booking about $306 million in revenue, but we need $241 million to cover the shortfall in the newly eligible category. Is that right? So we have about 306 and we need about 241. Does that free up $60-something million, $65 million to balance forward?
Thank you for the question. Melissa Lawfer-Lewis for the record. So essentially the division is anticipating a shortfall in federal revenue of that $306 million. However, it would not generate additional reversion funds. At this point, the division is anticipating a state general fund surplus at the end of the state fiscal year. However, the majority of those funds will be used as a part of our budget reductions for the next biennial budget.
So it's all right. Well, we'll use it one way or another. It's freeing up general funds one way or another, whether we use it for budget savings or balance forward. There's part of this is freeing up about $65 million in general funds.
That is correct.
And then, am I reading your work program correctly? That just in terms of projected expenditures for the current fiscal year, the newly eligible category has total expenditures of about $1 billion more than the MABID category. Is that right? Has it shifted that dramatically?
It has, and sorry, Melissa Lawfer-Lewis for the record. It has increased dramatically, with the additional maintenance of effort and the caseload requirements as part of the coronavirus relief funds. This is the largest population that we are seeing increases on. We are currently seeing about a 34% increase above ledge approved caseload. So this is definitely the largest increase in our budget.
Thank you very much. I appreciate it.
Thank you, Ms. Lawfer-Lewis, and thank you for the question, Senator Kiefer. Any other comments or questions on item 62? Seeing none, I would look for a motion to approve item 62 from Senator Kiefer, and second.
Second, Mr. Chairman.
Thank you, Chair Carlton. So I have a first from Kiefer and a second from Carlton. And any discussion on the motion? I see no discussion on the motion. So Ms. Coffin, could you please take a roll call vote?
Assemblywoman Benitez Thompson.
Yes.
Assemblyman Frierson.
Yes.
Assemblywoman Gorla.
Yes.
Assemblyman Hafen.
Yes.
Assemblywoman Howdeggy.
Yes.
Assemblyman Levitt.
Yes.
Assemblywoman Miller.
Yes.
Assemblywoman Monroe Moreno.
Yes.
Assemblywoman Peters.
Yes.
Assemblyman Roberts.
Yes.
Assemblywoman Titus.
Yes.
Assemblywoman Toles.
Yes.
Assemblyman Watts.
Yes.
Vice Chair Carlton.
Yes.
Senator Canizaro.
Yes.
Senator Dennis.
Yes.
Senator Don Deralu.
Yes.
Senator Goycochea.
Yes.
Senator Hammond.
Yes.
Senator Kiefer.
Yes.
Senator Ratty.
Yes.
Senator Severs Cancer.
Yes.
Chair Brooks.
Yes.
Motion passes.
Thank you, Ms. Kaufman. That brings us to our next agenda item is 66. Department of Health and Human Services, Public and Behavioral Health, the communicable disease. If we could walk through that one.
Good morning, Julia Peak for the record on behalf of the Division of Public and Behavioral Health. I'm joined remotely by Tori Johnson, and he oversees our HIV and AIDS program, and Christina Hadwick of our Division's Administrative Services Officer. Today we're requesting additional authority for our AIDS Drug Assistance Program, also called ADAP, for pharmaceutical rebates to continue to provide core medical and supportive services to our clients under Ryan White Part B. Happy to take any questions you have or provide further description.
Thank you, Ms. Peak. Go ahead, Assemblywoman Tice.
Thank you, Mr. Chair, and thank you for being here again, Ms. Peak. I always appreciate seeing you and all that you're doing for our state and your whole department. The reason I asked that this be pulled, I've received, I can't tell you the number of emails and tweets I have concerned regarding the HIV program and these pharmacy rebates and where the perhaps 2,500 to 3,000 clients that you list will be able to access that care. And I just wanted a description, because in the notes for this, it says that the care is actually given through Nevada Hopes, community and cultural training programs, and Southern Nevada Health District, Planned Parenthood, Washoe County Health District, Carson Human Services. So I wanted to make sure that this program and these monies are going to be, this rebate monies will be actually spread throughout this state, because there was some concern that they'll only be able to get their treatment through one program, one company, and I just needed some clarification.
Thank you, Chair, for letting me answer the question. Julia Peak again for the record. The rebates are incredibly complicated, so I'm going to try not to get in the weeds and I'll be high level. Yes, so all of the entities that you named do receive funds through this program to provide direct services. Our division does not provide direct services. We provide the funding for that to happen throughout the state. One of the things that we were seeing in late 2019 is that the rebates we were realizing versed on program utilization was getting smaller. So that difference, so our expenses were going up and our income was going down related to rebates. After investigation, we found out that this had to do with a number of the agencies in our communities turning to a 340B model. Yes, a 340B model. And we cannot realize a rebate if they're using that program model on the pharmaceutical dispense. And so again, we were seeing that go down. We offered a number of options for policy changes, but as we've talked about at prior IFC meetings to this body, our community partners were worried about that, as were our clients. So we've put that on hold. Today, we've requested information on program income, again, realized through that program locally, so that we can understand what policy implications we might make would affect our community partners. So we understand that we probably will not pull in the rebates needed. So what we've done in preparation for this is we've provided shortened subawards to our community partners so that we have time to realize those rebates. We don't want to overproject what we will award them, understanding that there could be potential cuts coming from the state for those programs. So again, at this point, everything is going to be offered at level funding for the next several months as we look at the 340B agency's program income versus our rebates and can better assess our obligations and their income going forward. We just want to make sure that our clients across the state can continue to get the services that they're accustomed to, whether that be done locally through program income and agencies or through the state, again, through rebates. We're not married to either option, but we just want to make sure that folks can continue to have the services that they need.
Thank you for that. If I might follow up on that, Mr. Chair, I just wanted to make sure that these, again, I'm actually okay getting in the weeds over pharmaceutical rebates. I think it's important that a lot of the members of this body are new. It's their first session on that. So I think perhaps after we're done here, I know we have a limited schedule, and in respect of that, that maybe a little primer on pharmaceutical rebates would be appropriate to all of our members, because I think it's important that they understand it, because certainly their constituents we'll reach out to them about that. So I think some follow-up on that. And then the second thing is that I just want to make sure that as you sort through these rebates and as you decide what the best is to maximize our return, that at the same time we don't limit and cut off some of these other resources that these folks so desperately need throughout this entire state. And it's no community is spared this horrific disease, and that we make sure this access to care is really important, and that this transparency with these rebates needs to be there. So I have no further questions. Thank you, Mr. Chair.
Thank you, Assemblywoman Titus. And any of the other committee members have any further questions on this item? It does not appear as if we do. So I appreciate your explanation, Ms. Peak. And I too, with Assemblywoman Titus, have received quite a bit of communications on this particular issue. And a primer, I think, would be in order, even if it's a one pager on the mechanics. I think that would be helpful to the members when they're communicating with their constituents. And so I would like to make that request as well, and for the committee. And if I do not see any other questions on this item, so I would look for a motion to approve item 62.
Mr. Chair, so moved.
I have that from Titus.
Second.
Second from Senator Dennis. And Ms. Coppin, will you take a roll call vote?
Assemblywoman Benitez Thompson.
Yes.
Assemblyman Frierson.
Yes.
Assemblywoman Gorlo.
Yes.
Assemblywoman Haven.
Yes.
Assemblywoman Howdigy.
Yes.
Assemblyman Levitt.
Yes.
Assemblywoman Miller.
Yes.
Assemblywoman Monroe Moreno.
Yes.
Assemblywoman Peters.
Yes.
Assemblyman Roberts.
Yes.
Assemblywoman Titus.
Yes.
Assemblywoman Tolles.
Yes.
Assemblyman Watts.
Yes.
Vice Chair Carlton.
Yes.
Senator Canizaro.
Yes.
Senator Dennis.
Yes.
Senator Dondarelu.
Yes.
Senator Goycochea.
Yes.
Senator Hammond.
Yes.
Senator Kieckeffer.
Yes.
Senator Ratty.
Yes.
Senator Severs Gansert.
Yes.
Chair Brooks.
Yes, and I misspoke. Assemblywoman Titus made the motion on item 66. I think I said item 62. By that Assemblywoman Titus made the motion on item 66, and Senator Dennis seconded that, and that was the vote. Apologies for the misspeaking. So that brings to 73 and 79, and we're taking those together. They both deal with TANF funds, and so we're going to take those together. And if you go ahead and walk us through those, please.
Sure. Good morning. For the record, my name is Steve Fisher. I serve as the administrator for the Division of Welfare and Supportive Services. And with me this morning, I have Robert Thompson, Deputy Administrator of Field Operations. Also on this morning, Julia Peak, Deputy Administrator from the Division of Public and Behavioral Health, and her team, in case there are specific questions about this program. Agenda items 73 and 79 are requesting $157,368 in federal temporary assistance to needy families block grant funding to expand the Nurse Family Partnership Program. We began discussions with the Division of Public and Behavioral Health probably back in July of 2020, talking about this program, and certainly determined at that point that it was a perfect use of TANF funds, really for the following reasons. Number one, Nevada would join 17 other states who use TANF funds to support their Nurse Family Partnership Program. Also, the Nurse Family Partnership is an evidence-based community health program with over 40 years of evidence showing significant improvements in the health and lives of first-time moms and their children living in poverty. And TANF, the TANF program, certainly promotes a two-generational approach. And so this fits nicely as well. The program has 3 goals, and one of the goals aligns really well and perfectly with a couple of TANF goals. Their goal is to improve the economic self-sufficiency of the family by helping parents develop a vision for their own future, plan future pregnancies, and continue their education and find work. And that aligns well with 2 purposes of TANF. The first one being to provide assistance to needy families so that children may be cared for in their own homes or in the homes of relatives. And secondly, end the dependency of needy parents on governmental benefits by promoting job preparation, work, and marriage. And finally, according to a 2015 study by Ted Miller from the Pacific Institute Research and Evaluation, the Nurse Family Partnership Services resulted in lower enrollment in Medicaid and SNAP, with an 8.5% reduction in Medicaid costs from birth to age 18, and a 9% reduction in SNAP costs in the 12 years following the birth of the child. So federal savings were estimated at approximately $3 billion for the TANF program, the SNAP program, and the Medicaid program. So these are really the primary reasons that we support the use of TANF funding for this program. We do, just to make a note, we do have a decision unit in our budget that supports the expansion of this program in state fiscal year 22 and 23. These funds for this work program that we're asking for will be used to cover expansion startup costs, for example, hiring of staff, training, etc., so that the expansion and the infrastructure is in place for the start of the fiscal year or soon thereafter. And so with that, Mr. Chair, open up for any questions you might have, or committee members.
And I believe we have a question from Assemblywoman Benitez Thompson.
Thank you, Mr. Chair. Thank you so much, Mr. Fisher. Obviously, I think we are all excited about potentially growing this program. And so I don't want you to think that I have any kind of qualitative questions. My questions are just more simply about logistics. So this particular request is a sub-grant down to Southern Nevada Department of Public Health. And then it's specifically May 1 through June 30th. So just the completion of this fiscal year. And then kind of like the same question I had for the Department of Education, right? We haven't yet closed these budgets on our side for the next biennium. So I guess, how do you imagine that all playing out in terms of continuity?
You mean as far as the funding's concerned?
Yeah, like I guess hypothetically, since we haven't closed the budgets, there would be the prospect that we might not have available funds to close out the budgets the way that they've been requested, or the shifts and adjustments in it. So as we fund this today through May through June, and then if we had any kind of changes for July 1, I guess realistically, what would that look like on the ground? Would that be hiring people and bringing them on board and then letting people go? Or are they more operational costs that have more flexibility, that aren't so much human capital based?
I guess if there were some issues with regards to closing the budget, I do know that we are anticipating having TANF reserves at the end of this fiscal year. So therefore, if there were some issues or concerns around that, we could certainly perhaps come before this committee again with another work program for additional funding if that were the case, if there were some issues with our budget and budget closing. But again, we do have, I think we're projecting around $30 million plus in our TANF reserve. So I do not foresee any sort of issues or problems with regards to being able to fund it with TANF dollars. I hope that answers your question.
I appreciate that. It's a little bit of kind of like we've got a lot of different chairs we're moving around and different decision points in that and for the upcoming biennium. And obviously we'd love to find things like this, but obviously, our hearts sometimes are bigger than our budgets too. So I just wanted to make sure that we weren't inadvertently painting ourselves into a corner and, raising something up that might not be possible to sustain, although we hope to. So that was kind of my line of questions. I appreciate that. Oh, wait, one quick question. It's just a piece I see, and this is just a technical piece. This is going to be sub-granted, but once it lands at the sub-grantee level, it won't be sub-granted out again, correct?
I may defer that question. I'm 99.9% positive that is the case. Is there someone from Public and Behavioral Health that can verify that for me?
Yes. Absolutely. Thank you, Chair, for allowing us the opportunity to speak to that. To the last question as well, I'll just note that as you all know, many of our programs are run on grant funds, and so our sub-awardees know that it's only contingent upon funding. So that we hope the outcome that this is a long-term investment. Certainly our sub-awardees know that all our funding is flexible. As it relates to the question that you just had, I'll defer to Clarissa Loper. I apologize. I interrupted her as she was answering.
No problem. Thanks, Julia. Clarissa Loper, for the record, yes, it is subgranted to the Southern Nevada Health District to run the Nurse Family Partnership. It is not subgranted down from there.
Perfect. I appreciate that. And then the expectation would be they would spend all $150,000 in a 2-month period, or that they're going to have that and then be able to. Does it all have to be spent by the end of the fiscal year, or just kind of planned for by the end of the fiscal year?
For the record, Steve Fisher, just planned for by the end of the fiscal year. I'm sure they will be expending some of it between now and we have 3 months. And I do have Brenda Berry on. If Brenda, do you know, is my statement correct?
I think I'm good. I just had an idea of how it might play out in, at the ground level.
Okay, thank you.
Thank you, Mr. Fisher, for the clarifying that for us, and thank you, Assemblywoman Ms. Thompson. Are there any committee members have any other questions on this item?
Mr. Chairman, I have a quick clarification, if I could.
Yes, Vice Chair Carlton, please.
Thank you very much, Mr. Chairman. So we're talking about TANF recipients, but they won't be the only folks that will be involved in this program. So what are the categories of the people that you're going to be reaching out to? Or will they all strictly have to qualify for TANF first?
Yeah, they're one of the requirements for this, to use TANF funds, there has to be a means test. So there has to be a test. So yes, this will include individuals who are on the TANF program.
Okay, so when we talk about the subcategories of women under 21, families with children with developmental delays or disabilities, families and serving in the armed forces, they're all within that world of TANF. It's not separate worlds.
That's correct. As long as they are eligible under a certain federal poverty limit, then they can be eligible for this program as well, or at least for the TANF funds in this program.
Thank you very much. I just wanted to make sure that was clear. We didn't want folks thinking that we were opening it up to a bunch of different groups, that there is means testing and they do have to qualify under TANF. Thank you.
Yes, thank you for the question. Good question.
Thank you for clarifying that, Mr. Fisher, and thank you, Vice Chair Carlton, for the question. Any other questions on items 73 and 79? Seeing none, I would take a motion to approve items 73 and 79 together.
So moved.
Okay. So I have Assemblywoman Benitez Thompson make the motion.
Second.
Second from Senator Dennis. Any discussion on the motion? See no discussion on the motion. Ms. Kaufman, will you please take a roll call vote?
Assemblywoman Benitez Thompson.
Yes.
Assemblyman Frierson,
Yes.
Assemblywoman Gorlo,
Yes.
Assemblyman Hafen,
Yes.
Assemblywoman Howdigy,
Yes.
Assemblyman Levitt,
Yes.
Assemblywoman Miller,
Yes.
Assemblywoman Monroe Moreno,
Yes.
Assemblywoman Peters,
Yes.
Assemblyman Roberts,
Yes.
Assemblywoman Titus,
Yes.
Assemblywoman Tolles,
Yes.
Assemblyman Watts,
Yes.
Vice Chair Carlton,
Yes.
Senator Canizaro,
Yes.
Senator Dennis,
Yes.
Senator Don Deralupe,
Yes.
Senator Goycochea,
Yes.
Senator Hammond,
Yes.
Senator Keycapper,
Yes.
Senator Ratty,
Yes.
Senator Severs Gansert,
Yes.
Chair Brooks.
Yes.
Motion passes.
Thank you, Ms. Kaufman. So that brings us up to our next item, which was item 83.
Good morning, Mr. Chair, members of the committee. For the record, Steve Fisher, Administrator for the Division of Welfare and Supportive Services. With me this morning is Christelle Askew. She's the Chief of our Child Care Program. Agenda item 83 is requesting additional authority of $92,725,733 in federal coronavirus response and relief supplemental act grant funds to provide assistance to child care providers to prevent, prepare for, and respond to the continued impact of the coronavirus. What I'd like to do, Mr. Chair, is turn it over to Christelle just to give an overview of how those funds are, how we're planning to spend those dollars. So Christelle, if you could, please.
Sure. Good morning. This is Christelle Askew, for the record, Chief of the Child Care and Development Program. So what we've done so far is we've developed a two-phase plan with some overlap, and our goal is to really support, have long-term impact on the child care industry. So one of the first pieces that we're looking at really is resolving the current crisis, current issues. So we know that we have continued low enrollment in childcare and supporting safety precautions as well. So just to ensure that childcare exists after the pandemic, we have to place a focus on sustaining existing business through subsidy and grants and PPE. So that includes support for subsidized childcare, and that's through temporary policy expansions, looking at subsidy based on enrollment rather than attendance, opening up the wait list to support frontline workers, including childcare staff, and then supporting licensed childcare in general. So we're looking at restoration grants, operating costs, stimulus grants, and then funding COVID-related supplies or purchasing and distributing PPE. And then the second phase of that really is, as the vaccine's rolling out and we assume people are going to be returning to work, we want to support the economic recovery of the state. So again, looking at provider and staff support and growth, and really looking at a long-term impact in the childcare industry. So that includes provider and staff recruitment and support, startup grants, restart grants for providers that closed due to COVID, wraparound support, including childcare networks for existing providers and newly recruited providers, utilizing existing community-based models to recruit new childcare providers to start new businesses, and again, supporting those existing license exempt family, friend, and neighbors, and helping them to become licensed childcare providers, grow into a business, serve more children. Targeted capacity building, we're looking at targeting childcare deserts. We really want to build a strong partnership with the business community and assist them with smaller learning pods for their employees. We have a really wonderful partnership with WIOA. We want to work with our family resource centers for recruitment. So really looking at those community partners and building this with them. We want to provide business trainings, technical assistance, pandemic-related health and safety trainings, and resources that are going to evolve with the need. And again, with the staff recruitment and support, really working with those staff, because workforce is a huge part of what we're doing, and looking at those existing community-based models for recruitment there too. Paid training and internships, our partnership with WIOA to go and do that recruitment piece, get them on board, provide the mentorship, paid internship, and placement in a position in the field of early childhood. And then really a large focus on tracking outcomes and return on investment. So it's all about data. We want to make sure we're looking at the outcomes. We want to look at the cost. We want to look at that ROI and look at the long-term results. And that's a sort of a high-level overview of what we intend to do. Thank you.
Thank you. Thank you, Ms. Askew, for the description. And I think we have a question from Assemblywoman Titus on this issue.
Thank you, Mr. Chair. I actually, I do have lots of questions, but I know that Senator Ganser also wanted this, so I will have, if it's all right with you, I'll let her ask the questions, and then I'll ask if mine aren't answered.
Absolutely. I appreciate that. I'm getting some of my members confused and mixed up. I appreciate that. Senator Ganser, would you go right ahead?
Thank you, Chair Brooks. I think we both were interested in this. And so one of the questions I had, because we don't have that much information, is we have a breakdown as far as counties and some of the entities. And it was mentioned sort of the accountability piece, because if we're paying for enrollment, but the kids aren't necessarily there, I kind of want to get an idea of what that looks like, because I do think we need good childcare in Nevada, and this will help with that. And so we need to make sure places do stay open, but I do want to see some of the metrics around that. And also a question on how you came up with the amount, the $93 million, I think it was.
So a piece of that, this is Christelle Askew for the record. In looking at long-term stabilization of childcare, part of what we're doing, in addition to trying to open up our wait list temporarily and pay by enrollment versus attendance temporarily, is really getting into those childcare programs and assessing what their longer-term needs are and providing support to help them accumulate cost savings. And one of the ways that we're doing that is by putting together a staffed childcare network. And that's part of that is a shared services agreement. And that takes some of the burden and some of the cost away from these providers so that they can have some of the funding freed up to help pay staff higher wages and just more money toward quality within the childcare program. Did I answer your question?
The shared services agreement. So are you talking about sharing in how they do the administrative piece of this for the grants?
Right. It can be several different. This is Christelle Askew for the record. First of all, absolutely what you said. It's part of the accounting piece, removing some of the burden of the business piece. And it's also things like buying things in bulk, learning tools, all sorts of equipment, supplies, and things that childcare providers need to come together and buy them in bulk and have a cost savings in that way as well.
So when you do that, do the entities like Children's Cabinet and Urban League and so forth, are those the entities that are actually purchasing and then they're distributing them to the child entities that are granted, receiving funds under their umbrellas?
This is Christelle Askew for the record. So at this time, we have some incredible technical assistance. We're working with an entity called Homegrown, and they're going to be helping us sort of develop a plan to put this together. Our hope is to have a tiered family childcare network that includes family childcare and also the smaller centers. And so we haven't sussed out all of the pieces yet as to how the funding will be distributed to the providers and how the support will be distributed to the providers. And in doing that, we're going to have deliverables and outcomes from these entities that would be partnering with us to do this. So we're working on it.
Is it your intent to come back and then report to us on how this is? It's a lot of money, the $93 million. So we want to make sure that we get the outcomes and that we are able to create a more robust network of childcare. So part of it's going to be the outcomes, given that this isn't established yet. Thank you.
Yeah, this is Christelle Askew for the record. We have every intention, and we're really hoping to gather all of the data, track this as we move through, and then have outcomes out the other side to share. Absolutely.
That's all I have now. Thank you, Mr. Chair.
Thank you, Senator Ganser and Assemblywoman Titus.
Thank you, Mr. Chair. I do have some additional questions, and thank you for answering the questions that have already been asked. But again, along that same line, I'm concerned about the monies and the accountability and the follow-up and how you are tracking it. So far, from what I can see from what was submitted with this budget item, there's been $110 million already spent towards this. This is an additional, other than what we've already authorized, an additional almost $93 million. And I see from just the 3 pages that were submitted with this that it's going to be distributed to the Urban League, the Children's Cabinet, and quote, various community partners. And I'm concerned about that funding, $93 million, then going away from your department into communities. And I'm worried about that accountability piece, that line item accountability, because once we distribute this, because I only see really you have down $1 million to actually go to care to PPE for the providers, $1 million. The rest of this huge amount of money is going out into the Children's Cabinet, Urban League, and quote, various community partners. And I just worry the further out it gets, who is really going to monitor that? Not just outcome data, but where does this money actually go? Who's going to spend it? When are they going to report to you? What are some community plans? And who in your department holds these folks accountable, and not just, gathering data, but really, are you just providing it to 565 childcare businesses? That's the number here. Is that all we have in our state? And what's your end goal? How many do we need in our state? Have you done anything about, as we go back to work, what the real needs are? So I'm very concerned about distributing this money out with really, how are we going to know outcomes?
This is Christelle Askew for the record. So we actually did stimulus grants to providers for 3 months of operating costs with the CARES Act dollars. In May, we were down by about 66% of childcare providers, and then we distributed out those funds for operating costs. And by the time we got to about December, we were up about close to, don't quote me, but about 95% of providers were back open again. And so they're still struggling right now with those overhead costs and keeping their heads above water. So definitely a portion of these funds will go out to be stimulus grants to those providers. And our hope is to provide a stimulus check to every licensed provider. They're going to have to complete an application, and we're going to gather as much data as we can about their capacity, enrollment, and attendance, and other information as well. Those funds, the CARES Act funds, appear to really have a positive impact on providers. So a good portion of these funds are going to go toward that similar type of thing, where we're looking at operating costs, and we calculated capacity into that. And so that's our intent, is to have that kind of impact again to help sustain those childcare businesses right now with their immediate need when they're running on a really thin margin. And as we all know, even before COVID, they were already running on quite a thin margin. So just trying to keep childcare, the industry, from going away with these operating cost grants. And then, yes, a portion of the funds will be going to some community entities. But our every intention is to be extremely involved in all of the activities that we do. And before we provide any funding for these activities, they're required through their subaward to give us their deliverables, to let us know what those outcomes are, and we will be monitoring how those funds are spent. And we'll be a part of developing the plan too. We'll have our subject matter experts involved and how to build in those plans, and PA from the federal government and from that entity Homegrown that I mentioned before. They're really excited to work with Nevada and help us with this plan.
Follow up, Mr. Chair? So do we only have 565 licensed childcare providers in this state?
This is Christelle Askew for the record. We do have more licensed providers than that number. However, we don't intend to provide operating cost funding to the Head Start programs, and they take up some of that number. That overarching number that you're looking at includes Head Start programs. Head Start programs are already federally funded, And in addition to that, they also received some COVID-related funding. So we're only looking at those licensed family child care, in-home care, and those licensed centers when we put together that list of providers.
So we have, excluding the Head Start programs, we have 565 licensed child care providers in the state.
We're looking at 560 providers. Before we disseminate the funding, our every intention is to make sure we've captured all of the licensed providers aside from Head Start. And so there may be a small shift in the way the funding looks, but it should be fairly similar. Does that answer your question?
Well, thank you for trying to answer my question, but you haven't actually. But what I would like to see, and I'm sure if it's okay with the chair to report back, again, I'm very concerned about the accountability piece of this funding. And when we distribute it to these major nonprofits and looking at where these monies are being spent, and does it really get to your intent, which is making sure there's access to a very good, high quality childcare throughout this state and everywhere. I'm looking at the breakdown of the monies that you spent, the 45 million in the different counties, but there's that additional piece, that additional $34 million that you really don't break down, and where has that gone? And so I'm very concerned, and really, I'd like to see not just data information as far as what you're saying at training, but the whole global business plan with this kind of funding and what you have in mind and where this is going to be spent. Because I truly think there's a need throughout this state, especially in needed urban centers and our in Clark County, and not to mention the rurals in Washoe County. But boy, there's a need. So I really would appreciate the follow-up on this funding, some outcome information, and really where does this money go, and not an overhead cost, administrative fees. Does it really get to children, which is what we're all here for? So thank you very much, Mr. Chair, for the line of questioning.
Yes, question. Can I call on, I believe Senator Kiefer had questions on this item as well, unless I am confused. Nope, I am confused. We do have Assemblywoman Benitez Thompson, however, who does.
You could see me just not sitting still in my seat, could you, Chair? You knew I was biting at the chomp. I appreciate that. So, yeah, we have a quality childcare issue on the state, and we've been talking about it and trying to pass measures and legislative measures to fix it for years. And it's been a conversation in the Health and Human Service Committee with bills brought by Assemblywoman Joyner, with bills brought by so many members, and also on in the Ways and Means Committee. And we are also that previous Governor Sandoval put a big chunk into childcare. So we've been in this conversation. And the reason why it's so important is because childcare is a small business that makes business work. And so if we are committed to getting women back into the workforce post-pandemic, then we're supporting childcare. We've been talking about the fact that we have a limited number of spaces for years and that we need to grow spaces. I think that we have seen that first chunk of money that was referenced, what happened with the first $32 million, that was the first chunk of money that came down in the first CARES Act. And this committee did talk about that $30 million. And we did have staff testify and talk to us and give us a great record about what was happening with that money. So I'm just really sensitive to the fact that we would paint it as if we have not been talking about this issue or haven't been talking about these dollars and where these dollars have been allocated and how we want these dollars to work. I don't want that to be the legislative record because we've all been asking and talking about this for a while. That being said, I do see that as I turn myself sideways to look at the spreadsheets that the department has submitted, that it looks like that we're still planning to have kind of wait list slots. And I understand that still might be a capacity issue, but I didn't know what percentage of that wait list might be capacity issue, as in there are not enough slots, versus if it was just funding and if we weren't planning to fund more slots.
This is Christelle Askew for the record. I think that we're going to get a lot more information about capacity versus enrollment and attendance when we get all of those applications back from providers. We're going to be getting a lot of data from them at that time. You know, our long-term goal in this program is really to take a look at how our subsidy program is set up, how we're doing our reimbursement payments, what families we're impacting. And our intention is to really overhaul what that looks like. So part of this funding, and this is what, was required in the guidance for the grant, is to provide those stimulus checks, which, like I said, they were really helpful last time. And then that other portion of money, that 30-something million, is to do all of those things, getting into the infrastructure of childcare, assessing what the various issues are. And we know a lot of what those are from doing needs assessments and things, but really getting in and trying to have an impact there. And then, yes, absolutely, as a part of our long-term goal, we intend to look at how many families we're serving, how we're serving them, and make some changes there as well.
I appreciate that. I think it's just a moment for if those dollars allow for any flexibility to talk about kind of the capital issue that comes along with childcare and increasing slots, which would mean, facility space. I think that would be a wonderful chance to do. It might be our one and only chance to actually catch up on that issue here in Nevada. I thank you so much.
Thank you, Assemblywoman Benitez Thompson, and thank you, Ms. Askew. And Assemblywoman, you just brought up like a really important point about, this is the front line. These are the first casualties of the pandemic, and families and childcare. And without childcare, our economy will not run. And we've seen that women have taken the brunt of the damage that's been caused by the pandemic, and they also disproportionately are involved in the childcare raising of our children. And so this is such an important piece, and seeing the federal funds go directly to helping on the front line, And I just appreciate what you're doing, Ms. Askew, and I appreciate everyone. This is what we voted on in IFC over this entire year. And I appreciate everyone who voted to accept federal funds so that we could put that into these programs. And I'm glad to see this is what we're doing and continue the work. And these are the front lines that we need to support. So thank you for the clarification and a question, Assemblywoman Benitez Thompson. And I think I saw Assemblywoman Tolles try to raise her hand for this item, unless I am confused again.
No, thank you. I just wanted to clarify. I think there was a question earlier about how we got to the 93 million figure, and I think I figured it out, that it was a certain amount multiplied by the 565 facilities that we have out there. I just wanted to confirm my understanding was correct.
This is Crystal Askew for the record. We looked at the capacity for all of these licensed childcare providers, and we calculated what 75% of operating costs would look like for that capacity.
Okay, thank you.
Thank you. Now, do we have any other questions on this item?
Mr. Chair, I just had a comment.
Second bite at the apple, Senator.
Thank you. I just wanted to say that I agree with the majority leader and with you that this is very important. I'm going to be supporting the motion. I guess I could have done it after the motion, or I can make the motion for you. I think we need to make sure we have quality childcare for Nevada's families so they can get back to work. And I think it's been a very trying year for all of them in different ways. And so I think this is really important. And I also appreciate that the department will be coming back with some accountability as far as where the money's spent and how it's distributed and so forth, because I think that's important. But you're right, for folks to get back to work, we need to be able to make sure that they've got quality childcare. And if we can help with that, we need to do it. So I don't know if you want to accept a motion at this time.
I will see if there's any other comments or questions on this item. And Vice Chair Carlton, did you want to make that motion? Is that what you're saying?
Yeah, Mr. Chairman, yes, thank you for recognizing me. I would move approval of this item. Thank you.
Second.
I have a motion to approve this item from Vice Chair Carlton and a second from yes. Any discussion on the motion?
Mr. Chair?
Yes, Assemblywoman Titus.
Thank you, Mr. Chair. And I too will be supporting this motion because I do think it's very important that we have childcare for getting Nevada citizens back to work, whether it's the moms or the dads who are responsible for the childcare. I think it's important that there is a quality childcare. But I also, the most important thing for me with my line of questions was the accountability piece. So I'm looking forward to supporting this, but actually even more so looking forward to the follow-up from the department and where these monies are being spent, and truly seeing that with these kind of fundings, we should be able to raise the bar on our quality of childcare. So thank you, Mr. Chair.
Thank you. So any other discussion on the motion?
Mr. Chairman, if I may.
Yes, Vice Chair Carlton.
And you know, just in response to that, that's the job of IFC. That's what we do. That's why we had 21 meetings last interim, is to make sure that everything is held accountable. So I don't want there to be any misconception out there in the public that IFC is not going to be doing its job after we sine die on May 31st. Thank you very much.
Thank you, Vice Chair Carlton. And any other discussion on this item before we take the vote? Seeing none, Ms. Kaufman, will you roll call vote?
Assemblywoman Benitez Thompson.
Yes.
Assemblyman Frierson.
Yes.
Assemblywoman Gorla.
Yes.
Assemblyman Hafen.
Yes.
Assemblywoman Haudegi.
Sorry, I was on mute. Yes.
Assemblyman Levitt.
Yes.
Assemblywoman Miller.
Yes.
Assemblywoman Monroe Moreno.
Yes.
Assemblywoman Peters.
Yes.
Assemblyman Roberts.
Yeah.
Assemblywoman Titus.
Yes.
Assemblywoman Tolles.
Yes.
Assemblyman Watts.
Yes.
Vice Chair Carlton.
Yes.
Senator Canizaro.
Yes.
Senator Dennis.
Yes.
Senator Don Derelu.
Yes.
Senator Goycochea.
Yes.
Senator Hammond.
Yes.
Senator Keycapper.
Yes.
Senator Ratty.
Yes.
Senator Severs Cancer.
Yes.
Chair Brooks.
Yes.
Motion carries.
Thank you, Ms. Kaufman. That brings us to our next item, and that is C94. And that is the Department of Employment, Training, and Rehabilitation and Unemployment Insurance.
Good morning, Linda Parvin, Administrator for the Employment Security Division. This work program brings in $7.6 million in federal pandemic unemployment assistance funds to support the implementation of and changes in the PUA program. There was an additional $5 million in the original work program that has been pulled and put into fiscal year 22 for continued contractual services in the PUA program. The $7.6 million supports $2.7 million in salaries and approximately $5 million in contractual services for the PUA program.
Thank you, Ms. Parvin. Appreciate that. And I think I'll open that up to any of the members who have questions. And I believe the first member I have with a question is Assemblywoman Danielle Monroe Moreno.
Thank you, Chair Brooks. I believe she just answered my question. I know when this work program was initially submitted, it was for 12.7 million, but then there was an amendment that we received in mid-March from the Governor's Office of Finance to make an adjustment. So I just wanted to confirm that this work program should be, as it was originally submitted, should be adjusted to reduce the PUA revenue by the $5 million. Is that correct?
Linda Parvin, again, for the record, yes, that is correct.
Thank you so much.
Thank you, Assemblywoman. Do I have any other questions on item 94? I do not see any, so I just want to, just clarifying, so I would be looking for a motion to approve, but based upon the revised amount as was just clarified by Ms. Parvin and in the question from Assemblywoman Monroe Moreno.
So move, Mr. Chair. This is Assemblywoman Monroe Moreno.
I have a motion from Assemblywoman Monroe Moreno.
Second.
Second from Senator Dennis. Do I have any discussion on that motion? All right, and just want to make sure that that motion is clear enough for staff to be able to create a record.
We're good, Mr. Chair.
Thank you, Mr. Thorley. And so with that, Ms. Kaufman, could you take a roll call vote?
Assemblywoman Benitez Thompson.
Yes.
Assemblyman Frierson.
Yes.
Assemblywoman Gorlo.
Yes.
Assemblyman Haven.
Yes.
Assemblywoman Howdiggy.
Yes.
Assemblyman Levitt.
Yes.
Assemblywoman Miller.
Yes.
Assemblywoman Monroe Moreno.
Yes.
Assemblywoman Peters. Assemblyman Roberts.
Yes.
Assemblywoman Titus.
Yes.
Assemblywoman Tolles.
Yes.
Assemblyman Watts.
Yes.
Vice Chair Carlton.
Yes.
Senator Canizaro.
Yes.
Senator Dennis.
Yes.
Senator Don Darrell.
Yes.
Senator Goycochea.
Yes.
Senator Hammond.
Yes.
Senator Kieckeffer.
Yes.
Senator Ratty.
Yes.
Senator Severs Gansert.
Yes.
Chair Brooks.
Yes.
Motion passes.
Thank you, Ms. Kaufman. That brings us to our next item, and I believe we have item 135.
Morning, Chair and members of the committee. Laura Rich, Executive Officer of the Public Employees Benefits Program. For agenda item C135, PEB is requesting a transfer of approximately $4.1 million from the state employee cost category to the retiree insurance category. This is something that the committee has seen before and will continue to see at future meetings because it is a result of the way the categories are broken up budgetarily as opposed to how they are rated and priced in that same risk pool. The retiree group is always more costly than the active group, but they are budgeted equally. So this results in the need to transfer between the two categories. Additionally, there is a projected shortfall of $848 in our non-state active category. PEB only has 8 non-state actives on the plan, so any fluctuation in claims are noticeable and quickly affect our projections. Finally, in category 4, PEB is requesting a transfer of approximately $263,000 to account for the increases in actuarial services that have been required by PEB, and also for PCORI fees, which are Patient-Centered Outcomes Research Institute. Those were projected to expire, but were extended by the IRS recently. So I'm happy to take any questions or provide any other information on this item.
Thank you. I appreciate that. And I believe that we had a question from Assemblyman Roberts.
Yes, sir. Thank you. Thank you, Mr. Chair. And thank you for the explanation and being here today. My real question is centered around you, and you kind of explained it, the actuarial estimates between the state employees and the retirees. And I see that, we were 10% off for state employee insurance cost, obviously in our favor, but under for retirees. And you believe that that's going to be continuing the trend. And the reason I ask is that in your budget request for next cycle, there's some adjustments to the retiree contributions, and just curious if that was figured out going forward as well.
So thank you for the question, Laura Rich. For the record, let me see if I can explain this in a very, very simplified manner. So the way that the risk pool works and the way that it is priced is in one single unit. And so let's say that, just for the sake of for the explanation, let's say that the cost is $10. Really, if you break it up, the cost is more like $6 for the retirees and $4 for the actives. But the way that it is budgeted, because we budget it separately, it's 5 and 5. And so there's always going to be a need to transfer that back and forth. And so this is just a way, there's a difference between, the way our risk pools work and then the way that the state accounting budget process works. Hopefully that makes sense.
Yes, ma'am. And thank you very much. That does make sense. And feel real comfortable voting yes on this. So thank you.
Thank you, Assemblyman Roberts, and thank you, Ms. Rich, for that explanation. Do any of the other committee members have any questions on this agenda item? Or on this, this item? I do not see any, so I would take a motion to approve item 135.
I'll make a motion, sir.
I have that from Roberts, a second from Senator Dennis. Any discussion on that motion? No discussion on that motion. Ms. Kaufman, will you take a roll call vote?
Assemblywoman Benitez Thompson.
Yes.
Assemblyman Frierson.
Yes.
Assemblywoman Gorlow.
Yes.
Assemblyman Hafen.
Yes.
Assemblywoman Howdigy.
Yes.
Assemblyman Levitt.
Yes.
Assemblywoman Miller.
Yes.
Assemblywoman Monroe Moreno.
Yes.
Assemblywoman Peters. Assemblyman Roberts.
Yes.
Assemblywoman Titus.
Yes.
Assemblywoman Tolles.
Yes.
Assemblyman Watts.
Yes.
Vice Chair Carlton.
Yeah.
Senator Canizaro.
Yes.
Senator Dennis.
Yes.
Senator Don Deraloup.
Yes.
Senator Gokachia. Senator Hammond.
Yes.
Senator Kieckeffer.
Yes.
Senator Ratty.
Yes.
Senator Severs Ganser.
Yes.
Chair Brooks.
Yes.
Motion passes.
Thank you, Ms. Kaufman. So that is all of the individual items that were identified or pulled for C, and that brings us to our last item under C, and that are the reclassifications. And I believe that we have a couple of reclassifications that we wanted to discuss, and I think we can start with the reclassifications in Department of Administration Director's Office.
Good morning, Mr. Chairman. For the record, my name is Laura Freed. I serve as the Director of the Department of Administration. I'm joined by personnel from the Admin Services Division. This action item is a reclassification of a Management Analyst 2 position to an Administrative Assistant 3 position that is consonant with the Governor's recommended budget. As we discussed in the Administration Director's Office budget hearing, the classification of this position was recommended by the Governor for fiscal year 22 and 23. Doing the reclass now allows the Commission for Women to have administrative support right now, since the position is vacant. It has been vacant for a couple of months now, and we have had to use Director's Office staff to support the Commission instead of the Commission members having their own staffer. The reclassification saves $17,276 in general fund in this fiscal year. And also reclassifying the position now gives any incumbent stability. If we were to recruit for a management analyst right now and the legislature were to approve the decision units in the GovRec budget, we'd have to downgrade any person who was in the position. Also, we've tried to recruit a temporary employee, and to be candid, we haven't been very pleased with the quality of the candidates we've gotten. So we feel like opening an admin assistant recruitment for the state would yield a better candidate pool. Also, I would note that as I testified during our budget hearing, the Commission for Women supports this reclassification, and they're eager to have their own assistant sooner rather than later. So with that, I would be happy to entertain the committee's questions.
Do I have any questions for Ms. Freed on this reclassification?
Mr. Chairman, if I may.
Vice Chair Carlton.
Thank you, and thank you very much. And I appreciate, Ms. Freed, what you're trying to do. This commission does some excellent work, and I've worked with them on a number of different issues, including a license plate. Everybody hold on to your hats. If I understand you correctly, you want to fill the position now at this particular level, and that way you can get a jump start on if we do the position in the future, it'll be level and there won't need to be any changes in the future. You're trying to true it up between this fiscal year and the next fiscal year.
For the record, Laura Freed, yes, ma'am, that is correct.
Okay. And this is only for this fiscal year. We'll make the decision on the rest of it as we close the budgets. Thank you, Mr. Chairman. I think that makes it perfectly clear. Thank you.
Vice Chair Carlton, thank you for clarifying that. And so thank you for putting that on the record. And so this just does just impact this fiscal year. And so with that, any other questions on this reclassification? I do not see any as I toggle between all my screens.
I would move for approval, Mr. Chairman. Thank you.
Thank you. I have a
Second.
Approval, Chair Carlton, a second from Senator Dennis. And any discussion on that motion? No discussion on that motion. Ms. Kaufman, would you take a roll call vote, please? On just this reclassification. The other reclassification was already approved in the original vote. And so we're just voting on this reclassification.
Assemblywoman Benitez Thompson.
Yes.
Assemblyman Frierson.
Yes.
Assemblywoman Gorla.
Yes.
Assemblyman Hafen.
Yes.
Assemblywoman Howdigy.
Yes.
Assemblyman Levitt.
Yes.
Assemblywoman Miller.
Yes.
Assemblywoman Monroe Moreno.
Yes.
Assemblywoman Peters. Assemblyman Roberts.
Yes.
Assemblywoman Titus.
Yes.
Assemblywoman Tolles.
Yes.
Assemblyman Watts.
Yes.
Vice Chair Carlton.
Yes.
Senator Canizaro,
Yes.
Senator Dennis,
Yes.
Senator Don Darrellou,
Yes.
Senator Goycochea,
Yes.
Senator Hammond,
Yes.
Senator Keycapper,
Yes.
Senator Ratty,
Yes.
Senator Seavers-Gansert,
Yes.
Chair Brooks.
Yes.
Motion passes.
Thank you, Ms. Kaufman. I appreciate that. And so that was our last item under agenda item C. And so we will move to agenda item D, the statement of contingency account balance. Mr. Thorley, will you give us the statement of contingency account balance, please?
Thank you, Mr. Chair. I'll move quickly. Wayne Thorley for the record, LCB Fiscal Analysis Division. The statement of contingency account balance can be found on page 233 of volume 4 of your packet. There are no requests on the agenda for allocations from the contingency account. So the current balance as of today will remain after this meeting. In the unrestricted general fund portion of the contingency account, the balance is $6,332,695.40. In the unrestricted highway fund portion of the contingency account, the balance is $1,638,068.35. And in the restricted portion of the contingency account balance, or the contingency account, the balance is $13,888,590.
Thank you, Mr. Thorley. Do any of the committee members have any questions for Mr. Thorley on contingency account balances? I do not see any. So thank you. And that would take us to our next agenda item. And our next agenda item is item E, request for allocation from the IFC contingency account. And so give me 1 second here, please. Oh, this agenda item has been withdrawn. Okay. Is that correct, Mr. Thorley? This agenda item has been withdrawn?
It is, Mr. Chair. This was withdrawn on March 8th. So if you would like, you can move on to the next agenda item.
All right, that takes us to agenda item F, requests for approval to accept gifts and grants. From the Division of State Parks, we have 2 items. We'd like to hear them together. That's item F1A and F1B, the Division of State Parks.
Good morning. I'm Janice Keeler with the Nevada Division of State Parks. This item is to request for approval to accept grant funds from the United States National Park Service Land and Water Conservation Fund in the amount of $6,751,950 to fund the creation and maintenance of recreational trails and supporting amenities throughout Nevada.
Thank you. And if you could go through over item B as well, I mean 1B.
Item B is to request for approval to accept grant funds from the United States Department of Transportation, Federal Highway Administration for the Recreational Trails Program in the amount of $1,249,313 to fund the creation and maintenance of recreational trails and supporting amenities throughout Nevada. So these 2 grant programs are programs that Nevada State Parks manages on behalf of the state of Nevada. And these are our annual allocations that we automatically receive from the National Park Service and the Federal Highway Administration. So I'm happy to answer any questions that you may have.
Thank you. Does the committee members have any questions on item F1 and A and B? I do not see any questions, so I take a motion to approve F1, A, and B.
Mr. Chairman, so moved. Approval of F1, A, and B.
Thank you, Vice Chair Carlton, for the motion, and the second from Senator Dennis. Any discussion on that motion? See no discussion on that motion. Ms. Kaufman, will you take roll call vote?
Assemblywoman Benitez Thompson.
Yes.
Assemblyman Frierson.
Yes.
Assemblywoman Gorlo.
Yes.
Assemblyman Hafen.
Yes.
Assemblywoman Howdigy.
Yes.
Assemblyman Levitt.
Yes.
Assemblywoman Miller.
Yes.
Assemblywoman Monroe Moreno.
Yes.
Assemblywoman Peters.
Yes.
Assemblyman Roberts.
Yes.
Assemblywoman Titus.
Yes.
Assemblywoman Tolles.
Yes.
Assemblyman Watts.
Yes.
Vice Chair Carlton.
Yes.
Senator Canizaro.
Yes.
Senator Dennis.
Yes.
Senator Don Darrellou.
Yes.
Senator Goycochea.
Yes.
Senator Hammond.
Yes.
Senator Kekeffer.
Yes.
Senator Ratty.
Yes.
Senator Severs Ganser.
Yes.
Chair Brooks.
Yes.
Motion passes.
Ms.
Thank you,
Kaufman, I believe Ms. Peters has returned if she wanted to record her vote.
Thank you, Vice Chair. I did get to record my vote. Thank you.
Thank you, Vice Chair Carlton. Thank you, Assemblywoman Peters. And thank you, Ms. Kaufman. That brings us to our next item under F, and that's F2. And we're going to take F2, A, B, C, and D all together. And that's from the Department of Wildlife. And so if you could walk us through all four of those items together, I would appreciate that. And so just so that we're oh, there we go. Director Bosley, thank you.
Thank you, Mr. Chair. I'm sorry. I didn't recognize that was my cue. I thought you were looking for staff to walk you through that. I apologize. Thank you for the opportunity to be here before the committee today. F2, A, B, C, and D represent 4 requests to the committee for acceptance of donated funds. A is a request for approval to accept a donation of $30,000 from Pew Charitable Trust to support the Nevada Connectivity Plan development and production, which is to identify and conserve migratory corridors of wild ungulates and other key species. It involves GPS collaring of animals and, excuse me, delineation of migratory movements within the state. 2B is a request for approval to accept a donation of $43,587.97 from KG Mining Bald Mountain, Inc. to fund the cost of materials for guzzlers, which are artificial water catchment devices to support wildlife populations. 2C is a request for approval to accept the donation of $500,000 from Nevada Gold Mines, LLC Cortez District for the completion of the Toyabe Fingers Mule Deer Habitat Treatment Project, which it primarily consists of the removal of encroached pinyon juniper trees. And 2D is a request for approval to accept the donation of $40,000 from the Mule Deer Foundation for the Towano Mountain Restoration Project for the benefit of mule deer. I'll try to answer any questions, and I also have staff standing by should there be any questions of a technical nature.
Thank you very much, Director Wasley. I have one question, and then I'll open it up for anyone else. All four of these items are donations. Are they parts of settlements or agreements, or are these donations made, just charitable donations made to the state?
Thank you for the question, Chair. These are donations for donations' sake. Each one is related to, for example, the 2A from Pew Charitable Trust. This is related to the implementation of Secretarial Order 3362 on migration corridors and movement patterns of ungulates, 3 ungulate species in 7 western states. And they are contributing to the agency's understanding. Each of these donations, as is required for acceptance of these, are accompanied by a letter that specifies the acceptable and intended use of the funding. In certain instances, some of our industry partners, for example, some of the mining companies, have requirements associated with the National Environmental Policy Act. They need to provide data relative to potential impacts. Oftentimes, they believe we are better suited to collect and analyze that data. Also, in some instances with industry partners, they may make gentlemen's types agreements that they would like to try to offset their impact. This is really just not a requirement. They're not providing these funds to the state as a requirement of mitigation, but it's a voluntary partnership where they're trying to be good community members and offset impacts to some of their activities. So there are none of these requests that constitute required, legally binding, or otherwise compensation to the department. These are true donations, each of which is accompanied by a letter describing the intended usage of these donated funds, upon which the agency will voluntarily provide reports to the Board of Wildlife Commissioners twice annually.
Perfect. Thank you. I appreciate that. Do any of the other committee members have a question on these 4 items for the Department of Wildlife?
Yes, Mr. Chairman, I do have one silly question to ask, and if I may.
Please, Vice Chair.
Thank you. Mr. Wasley, thank you for being patient with me, but you got to tell me what an ungulate is. I'm sorry. It's not a native species to a 14. So.
I'm sorry. Thank you for the question, Vice Chair Carlton. Deer, elk, and antelope were the 3 target species in the secretarial order, and those are the species, primarily deer and antelope, that the department will take advantage of this partnership with Pew Charitable Trust to put some collars on mule deer and pronghorn antelope to better understand their movement corridors.
And thank you, Mr. Wesley, for your patience. Are we going to track that moose that's out there? Because I know Assemblywoman Swank is probably listening, so she's going to be interested in how our moose is doing.
We already are. Thank you for the question, Vice Chair. We have multiple moose collars out there.
Okay, good. Thank you. Thank you, Mr. Chairman.
Thank you, Vice Chair, for asking the question that I was embarrassed to ask myself. So I appreciate it. Now I know what an ungulate is. Thank you very much. Do any of the other committee members have any questions on these 4 items? Do not see any. So thank you, Director. And I would be looking for a motion.
Motion to approve.
All four. I don't know who that just came from.
Senator Goycochea, motion to
Oh,
approve.
Senator Goycochea, I appreciate the motion. And do I second from Vice Chair Carlton? Any discussion on that motion? Seeing no discussion on the motion, Ms. Kaufman, will you please take a roll call vote?
Assemblywoman Benitez Thompson.
Yes.
Assemblyman Frierson.
Yes.
Assemblywoman Gorlo.
Yes.
Assemblyman Haven.
Yes.
Assemblywoman Howdigy.
Yes.
Assemblyman Levitt.
Yes.
Assemblywoman Miller.
Yes.
Assemblywoman Monroe Moreno.
Yes.
Assemblywoman Peters.
Yes.
Assemblyman Roberts.
Yes.
Assemblywoman Titus.
Yes.
Assemblywoman Tolles.
Yes.
Assemblyman Watts.
Yes.
Vice Chair Carlton.
Yes.
Senator Canizaro.
Yes.
Senator Dennis.
Yes.
Senator Don Derelu.
Yes.
Senator Goycochea.
Yes.
Senator Hammond.
Yes.
Senator Kieckeffer.
Yes.
Senator Ratty.
Yes.
Senator Severs Ganser.
Yes.
Chair Brooks.
Yes.
Motion passes.
Thank you, Ms. Kaufman. That's the last thing under agenda item F, and that moves us to agenda item G, informational items. Staff did not identify, nor did any of the members identify any informational items for discussion this morning. And this is informational items only, so no motion will be necessary. So if there is nothing to discuss on this item, I will move to the next agenda item. All right, and so the next agenda item is agenda item H, public comment. This is the second and last public comment period. As we discussed earlier, we are very time constrained today, unfortunately, and I'm limiting the agenda item to 15 minutes, and that is a maximum of 2 minutes per speaker on this agenda item. So BPS, would you please open the public comment line and see if we have anyone on the public comment line, and give just a minute for them to join if they're not.
Thank you so much, Chair Brooks. The public line is open and working, and there are no callers at this time. Would you like to take a pause to allow the people watching online time to call in?
Please, let's just give it about 1 minute, and then we can move to the next agenda item if there aren't any callers.
Thank you so much, Chair. BPS standing by. Caller with the last 3 digits, 393, please press *6 now to unmute. Thank you, caller with the last 3 digits, 393. Please slowly state and spell your name for the record. You will have 2 minutes and may begin.
Hello, good morning, members of the Interim Finance Committee. For the record, my name is Ian Bigley, IANBIGLEY, and I'm providing comment on behalf of the Progressive Leadership Alliance of Nevada in regard to item F. We currently rely on corporate charity to fund certain conservation efforts, and this is not sustainable, as eventually the mines will leave. We recognize the importance of these donations in this moment. Yet we must put in place reliable long-term funding mechanisms in addition to these donations before it's too late. We support the acceptance of these donations as a part of mining's responsibility to address the externalized costs associated with their profits, since we are not collecting adequate extractive taxes to compensate for losses in Nevada. For example, according to the 2019 to 2020 Net Proceeds of Minerals Bulletin, Bald Mountain grossed nearly $250 million in 2019 and paid zero extractive taxes under the Net Proceeds of Minerals tax due to the enormous deductions we allow for mining and no other industry to take. However, we note that reliance on corporate charity is not a predictable long-term funding strategy for conservation. For these reasons, we urge legislators serving on this committee to recognize the importance of the 3 mine tax proposals to be heard this legislative session, with specific attention to AJR 1, which would remove the deductions that allow 43% of gold and silver mines in Nevada to pay zero extractive taxes in 2019, so we can compensate for the finite resources that they remove and the inherent destruction associated. We understand that none of these proposals provide revenue specifically for conservation, though through better funding our state via taxes, which are much more predictable than occasional charity, we are able to better manage our financial resources to put in place long-term conservation funding plans, which are determined by Nevadans, not on the whim of corporate leaders outside of the state. Thank you.
Thank you, Chair Brooks. The public line is open and working, and there are no additional callers at this time.
Thank you. I appreciate that. So that is the end of that agenda item, moving us to our last agenda item, which is adjournment. I do need to remind the members that we are going to go right into a joint full committee, and we'll need approximately 15 minutes to transition from our current IFC committee to the joint full, and we will have to then log out of this particular meeting and log into the next meeting. And so if after this adjournment, don't go far, just try to log back into the other joint full link that you have so that we can roll right into this thing just as soon as broadcast services gets us up and running. With that, this meeting is adjourned.